Hello, nurses. Today we will be talking about focus charting or the FDAR. So, this is a very important component that we have to discuss today because FDAR tackles more about documentation and the things that you have to know in order for you to document whatever findings that you can find into your patient as you have your duty here in Southwestern University Medical Center. So for the learning objectives, after 25 to 30 minutes of discussion, learners will be able to, number one, define what focus charting is. Number two, enumerate the different documentation principles of writing an FDAR. Number three, contrast the objectives in making an FDAR. Number four, point out the contents of focus charting. Number five, adopt the guidelines in making an FDAR. Number six, differentiate the do's and don'ts of FDAR. And number seven, infer on the sample FDAR as presented. So what is focus charting? We describe focus charting as patient's perspective and focuses on documenting the patient's current status, progress towards goals, and response to intervention. As nurses, in making FDAR, it should be patient-centered and it should not be nurse-centered. So whatever observation that we can see into our patient, especially those progress towards goals of care that we provide to them, that is basically our focus. Second, it is defined as a systematic approach to documentation, using nursing terminology to describe individuals' health status and nursing action. When you say approach to documentation, it's one way for us to document it in the patient's chart. So this is considered as a legal aspect in the nursing profession. We use nursing terminologies that are accepted and the best thing that it could describe to our patient's health status. And of course, nursing action as part of the content of the FDAR. Focus charting brings the focus of care back to the patient and to the patient's concern. Instead of a problem list or list of nursing or medical diagnosis, a focus column is used that incorporates many aspects of patient and patient care. So FDAR is being divided into four different columns. So one of the column that is being emphasized in the documentation process is the focus column. So when you talk about the focus column, it talks about what is your focus to your patient. It could be at least one or at least two, but probably we could go into three or four focuses, no, in the observation that we got into our patient during our 8-hour shift in the hospital. So we also have documentation principles. So documentation must be able to determine first what an event happened. So it's very important to know what are the specific events that happened during your duty. When the time that you've interacted to your patient, what are the things that happened or what are the experiences that happened? And to whom it happened. So usually we pertain to the patient because this is a patient-centered documentation. By whom it happened. So usually there is an interrelation between the patient as well as the nurse. Sometimes we do collaborative care with the involvement of the doctor or any other healthcare allied professions, such as your med techs, your respiratory therapist, you also have your physical therapist and the like. Why it happened. So when you say why it happened, as to why is a specific situation happen into that shift. So that could be discussed. It could be discussed into your actions. The result of what happened. So when you say result, that means you say the last portion of the documentation. So when you did all the nursing interventions, all the documentations, either interventions such as independent, dependent, collaborative interventions, what happened right after you did it? Another thing is we have to maintain confidentiality of all patients' information. This is very important that we shouldn't talk as to what is going on to the patient's condition. We have to maintain confidentiality. All information should be kept in the nurse's station. So if students have access or staff nurses have access to the information of the patient, they need to be discreet in handling these informations because it's one way for us to make sure that we could preserve the integrity. Documentation will be retrievable. So when you say retrievable, anytime we could access the documentation. So say for example, we have to look into consideration as to what the nurses are doing or student nurses are doing to the patient. We can review as to what they're doing. Documentation should be neat, legible, and non-erasable. So usually in FDAR, we have to use different colors of ball pens in our institutional policy. In documenting, we have to use black in the morning, blue in the afternoon, and red in the night shift. And the penmanship of the student nurse or the nurses, no, should be legible, meaning to say it should be read well, no? It can be read. And at the same time, it should be neat. There should be no erasure because it's very important to make sure na there would be no erasures because it is a legal documentation. Record must be accurate, true, honest account of what occurred and what it occurred. So in documentation, the policy of honesty is still there. Whatever things that you observe to your patient that needs to be documented. Whatever aren't seen to your patient or the things that aren't done to your patient should not be documented. Just to add up with the documentation principles, documentation contains meaningful information and avoids meaningless phrases such as good night, up and about, and usual day. Information documented must be relevant. So we have to avoid these types of unmeaningful information because that would lead to confusion. In order for you to obtain a meaningful information, it should be based on the interventions that you've made to your patient. And by the way, in doing so, you have to use the past tense in doing a narrative report. Documentation must be reflective of observation and unfounded conclusion. So when you say documentation that reflects through observation, there is this one content in your FDAR that you need to provide the data. So in the data, you have to input whatever are the objectives and subjective cues that you've observed to your patient. And if you're talking about actions, we also have a certain part in FDAR that we have to provide our actions in such a way that it should be reflective of the observations that we are able to observe to our patient itself. Documentation must reflect the assessment, planning, implementation, and evaluation of patient care. We have to consider ADPI in doing our FDAR. Aside from doing the ADPI, by the way, ADPI stands for Assessment, Diagnosis, Planning, Intervention, and Evaluation. Although in the diagnosis, it couldn't be nursing diagnosis aren't really applicable in doing FDAR, but through nursing diagnosis, we could come up with the different signs and symptoms that we could provide it as a focus. Later, I'll be talking about certain examples that would guide you in identifying what focus that you have to do or what you're going to place in the documentation. Aside from ADPI, you have to consider as well the smarter format. So when you say smarter, as I always inculcate this to my learners, especially students and staff nurses, that it should be specific, measurable, attainable, realistic, time-bound, and it should be effective or efficient, and as well as rewarding to the student nurse. So those 7 components should be part of your FDAR. Next is you provide current, clear, complete, concise, concrete documentation of the patient's status with least possible duplication of information. As much as possible, it should be clear and well understood. It should be complete and it shouldn't be incomplete. It should be at least as succinct as much as possible because it's easier for us to understand if we will be able to construct a concise data for our patient. And at the same time, there should be no repetitive words that should be used because duplication is a no-no as part of our principle. You also have to avoid statements such as appears to or seems to, which describes observation. So ambiguous statements or observations that aren't clear shouldn't be included in the documentation process. We also have documentation will contain all clinical observations, actions taken by healthcare providers, all treatment, as well as patient's response to the care provided. So whatever that we provide as part of the healthcare team, we are being pertained as the healthcare providers in this situation. Okay, so for FDAR, only nurses are the ones who can do so. Doctors aren't allowed to write in FDAR or other health allied personnel because in FDAR it is more into the nursing documentation. And you have to document in a timely manner. So during or as soon as possible after delivery of care, never chart before the delivery of care. So right after you've done the intervention, directly chart it into the patient's chart. Do not delay it because you might be able to forget all these interventions that you did to your patient. And take note of the word before. Do not write certain observations or documentation without doing it because again we have to go back to the principle that whatever is being done should be documented, whatever wasn't done shouldn't be documented. Chart in chronological order, documenting entries in sequence of events. So it should be in sequence. So if you did this one at first, then you have to document it first in the chart. If this is the second intervention that you've done, it should be the second one. And during the ordering of the different entries that you have written in the chart, it should be guided with a time. Okay, so it should be time bounded at the same time. So in this particular time, say for example, around 8 o'clock in the morning, what did you do to your patient or what data that you're able to extract to your patient? So if it's already 9 or 10 o'clock, you have to indicate the time and then you provide the different actions that you've done to your patient. So that is how you are being guided in terms of chronological order in documenting. So focus. Let's talk about focus. So, focus is a keyword or diagnostic category from a nursing diagnosis or collaborative problem on the plan of care. So, it's the action plan. So, say for example, you have there a focus of skin integrity. You also have coping, activity tolerance, and self-care deficit. Those are just good examples that you have to take note. Next is a current individual concerns or behavior. So, say for example, nausea, chest pain, pre-op teaching, hospital admission. These are very good examples in terms of the concern of an individual or certain behavior that you're able to observe to your patient while patient is in the bed or patient is in the emergency room or even in the different department of the hospital, such as in the operating room, in the ICCU setup, or even neonatal care unit and the like. You also have to consider a sign or symptom as much as possible and the importance of the nursing and or medical diagnosis of treatment plan. So during your rounds, you will be able to observe your patient, right? So some of the examples that we can consider are fever, constipation, hypertension, incontinence, and even lethargy. So those are some of the few good examples that you can have into your focus. So I've noticed that most of the staff nurses and even student nurses are fond of having continuity of care or at the same time receiving assessment alone as their focus. Well, you can have those kind of focus, but make sure that there should be a real focus that you could identify, okay? Based on the category of what is being discussed. Next is focus can also be an acute change on the individual's condition. Example, respiratory distress, seizure, fever, discomfort. So patients are admitted. So we can really identify a certain problem. If patients aren't admitted, that means to say that they don't have a problem, but since they're in the hospital, I'm pretty sure that you could even find at least a certain focus that you can have for your documentation on that particular shift. And a significant event in the individual's care. So, say for example, begin treatment of regimen such as O2 therapy. You also have to change. You also have to consider change in diet and catheterization. So catheterization falls into nursing procedure. That could be a great focus that you could identify. A keyword or phrase indicating compliance with a standard of care or agency policy. So, say for example, self medication teaching plan and even transition. And even discharge planning is a very good focus for you to have if your patient have discharge orders from the doctor. Focus notes are necessary to document a new finding. So from time to time, you are assessing your patient, you are taking the vital signs, you are monitoring the patient. It depends on the doctor's order if you have to go back to the room of the patient every 4 hours, every 2 hours, or sometimes QRly if it's in critical condition or in guarded condition. So take note of the different findings or new findings that you can observe, and you can utilize that in your focus. So in focus, it doesn't mean that you just have to identify one. You have 8-hour shift to comply and you have 8-hour shift to care for your patient. So sometimes if the patient's condition is not stable, no? So tendency you'll be able to come up with at least two or even three focuses, no? Sometimes in the ICU, I've noticed ICCU staff nurses are trying to identify certain focus in every hour of care that they have into their patient because it's a one is to one interaction or a nurse patient relationship, no? So the ratio is 1:1, sometimes 1:2. So in a particular hour they're able to identify lots of focus, probably five or even six focuses, no, on the particular shift. The purpose of the note is to document a new sign or symptoms or a new behavior, as what was being explained, just to emphasize, in which it should be current focus of care. So these may be a temporary focus which do not need to be incorporated in the plan of care because they can be quickly resolved even if you are uncertain whether the sign or symptoms are important. It is valuable to communicate the information to the healthcare team. So when doing your documentation, it doesn't mean that whatever you observe, it should be on your own alone. Okay, so or you are keeping it on yourself. Whatever observations that you are able to extract coming from your patient should be well coordinated with the doctor, as well as what it should be well documented. So there is still a collaborative way of interventions given to the patient. So say for example, you're able to identify that your patient was hypertensive on a particular hour. Then you wanted to document it. That is correct that you have to document it, but you also have to refer it either to your clinical instructor if you're a student nurse, or you can go directly to the head nurse and refer it directly to them. And if you're a staff nurse, you can directly refer it to the head nurse or even collaborate directly with the doctor. In that way, the hypertension of the patient will be well managed and it interventions will be provided. So, focus notes are necessary to document an acute change in patient's condition when there has been an event of new patient condition. So, say for example, the patient got admitted, no, with with abdominal pain at the emergency room. Suddenly, the patient had respiratory distress after providing management or interventions. That could be a great focus that you could indicate into your documentation. Okay, so certain phenomena or certain experiences coming from the patient in which you did not expect to happen during the admission or even in the continuity of care at the ward or private rooms. Seizure and even code blue, no? So when you say seizure, Sometimes it wasn't really observed when the patient got admitted at the emergency room, but as time goes by, after the patient's second, third, or fourth day in the hospital, patient experienced seizures. So that could be a great focus, no, that you can document. And even code blue, in which patient deteriorated during his or her stay in the hospital because of certain conditions or even in a critical condition. Focus notes are also necessary to document a significant event or unusual episode in patient's care. So examples are admission. You also have your pre-operative assessment, post-operative assessment, pre-transfer assessment, discharge planning, transfusion such as your blood transfusion, platelet transfusion, or apheresis, and even PRN medications as required. So I just would like to highlight the PRN medication being required because in giving PRN medication, you have to assess the patient prior to giving the medication and right after giving the medication. So the right to assessment and evaluation is there. So it could be part of focus. However, students are fond of putting, or even staff nurses are fond of putting a medication regimen, and it shouldn't be a good focus for our patient because it's really intended that we have to, it was really ordered by the doctor that we really have to give medication to our patient. So sometimes it could be considered as a redundant entry in the FDAR. Another very good example of redundancy is vital signs taking. Okay, so we happen to know that in every 2 hours or 4 hours, we have to check the vital signs of the patient. It depends on the doctor's order. So it shouldn't be provided in the FDAR documentation because it's already in the chart. We have a particular page in the chart in which we provide the vital signs of the patient, which is the monitoring sheet. Okay. Another very good example is taking INO. No, so staff and student nurses are also fond of taking INO, when in fact there is a particular documentation or particular sheet, which is the INO documentation. Okay, that's the input and the output. So no need for you to do that in the FDAR because it could be considered as a redundant documentation. Focus notes are necessary to identify the discipline making and entry as well as the topic of the note. So say for example, social service or financial assistance, dietitian for instruction of low-fat diet, and physical therapies or doing your crutch walking. So sometimes no patient are still in the hospital even though that the treatment process is done due to financial reasons. So we can consider social services or financial assistance as part of the focus of our patient. Okay. And a very good example as well is through your discharge planning. No, now we have to coordinate with a dietitian in terms of the instruction of low-fat diet or even low-salt, low-fat diet, or even diabetic diet for patients who are diagnosed with diabetes mellitus type 2. Okay. And focus notes are necessary to best describe the patient's condition in relation to medical diagnosis when the patient's focus is the pathophysiology rather than the patient's response to the problem. So this happens most frequently in high technical areas such as in the critical unit or in the critical care. Okay. Sometimes doctor do their own way of diagnosing patient, and that's what you call as medical diagnosis. We could infer and make nursing diagnosis based on the medical diagnosis which is being presented by the doctors. No, so in that way, especially in the nursing diagnosis, we have this nursing problem as well as the etiology and manifestation as part of constructing a nursing diagnosis. It could be break down into three different parts, and it could be considered three different focuses, no, that you will be able to apply it in your FDAR documentation. So you can have the nursing problem as your probably first focus. Second focus is the etiology, and the third are the manifestations, or even you go for fourth and a fifth focus in your FDAR. So after focus, we have to identify data action and response. So when you say data, it's more into the subjective and or objective information supporting the stated focus of describing observation at the time of significant events. So before you write this one in the documentation or in the FDAR page, you have to write the letter D followed by your subjective or objective information supporting to the focus. So whatever is the focus, the data should be relevant. So sometimes the focus is, say for example, difficulty in breathing, but the data in which student nurses and staff nurses are placing or they're trying to place their a data in which vital signs of blah 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 with an IV of blah blah blah, no? So when you say data, it should be relevant to the focus. Okay. So whatever is the focus, the data should be related. Next is the action. So it's a these are nursing interventions that are performed. Okay. So when you say perform, that is it already happened. So you have to use past tense. Okay. Plan to be performed or protocols and procedures initiated. Okay. So action should start with a verb and the verb should be in past tense. Okay. So prior to writing the action, you have to write your letter A followed then by your nursing interventions that were being performed. Okay. Again, it should be past tense because this already happened. It will not happen in the future, but it was already performed. Okay. And in actions, make sure that you have to identify at least more than 5 actions, no, on a particular focus. 5 because in identifying a focus with a relevant data of it, no, in an 8-hour shift, sometimes, no, the 5 interventions are just few of the enumerated interventions that you've done. Sometimes it exceeded to more than 5, no? So at least you will be able to identify 5 nursing interventions during your 8-hour shift, no? If you only have one focus. So, okay, that is just an example. Next is it should be followed by a response. Okay, so this is a description of individual's response to the medical and nursing care and statement that the action plan of care outcome has been attained or are processing toward attainment. So before you write your response, it should be written first with the letter R, followed then by the description of the response, okay, of the individual or the patient. Okay, so in the response category, it could be a positive or negative response. So whatever actions that you've done to your patient, what happened to your patient right after doing so? Was the patient did the patient respond to your certain interventions or the patient deteriorated right after you've done your intervention? So there is no right or wrong in providing the response coming from the patient because it's merely observation based on your clinical findings. Okay. So you have to remember that information from all of these categories, such as your data, your action, and your response, should be used only as they are relevant to your focus or available. So as what I mentioned, it should be relevant to the data, okay? And it should not be fabricated or you don't need to identify certain actions or response in which it is not correlated, okay? Especially to the focus. However, all appropriate information should be included to ensure complete documentation. Okay. And at the same time, data and action are responded at 1 hour and response is not added until later when the patient's outcome is evident. So sometimes in documenting FDAR, usually we tend to put there 8 o'clock in the morning and right after your entry in the 8 o'clock, it goes directly to 2 o'clock in the afternoon. So you've already ended into your shift. The the most important thing to do is to identify actions and even data from time to time. Okay, so a student nurses as well as staff nurses, we have to be accountable to our patient's condition and we have to check it from time to time. So it's our responsibility to observe what is happening to our patient. Okay, so bedside care is very important, especially in an 8-hour shift. Okay, but I understand in the condition or the situation of the staff nurses because sometimes you are loaded with um 5 to 6 patients in one particular shift. Okay, so sometimes bedside care aren't observed or isn't observed rather. But for students, you are with your patient for 8-hour shift, then you must strictly have bedside care to your patient. Okay, so in that particular bedside care that you have with your patient, of course, you would be able to identify certain actions, no, or data coming from your patient, no, and with that, you might be able to come up with a good response because you are going to provide nursing interventions as part of your actions from time to time, no? Okay. So objectives in making FDAR. So to easily identify critical patient issues and concerns in the progress notes. So that is why you have your objectives. And by the way, having your objectives should follow with your Kashyap format. So that is knowledgeable, knowledgeable. It should have attitude, skills, habits, experience, and behavior. Okay, so that is the mnemonic Kashyap stands for. And you also have to facilitate communication among all disciplines. So as I've mentioned, there should be a collaborative intervention and collaborative care to your patient. You have to refer any unusualities that you found from your patient or observed from your patient. Next is to improve the efficiency with documentation. If you're going to end your shift, make sure that you can document. You really have an entry in the chart. It's a no-no to go home without an entry in the chart because you are taking good care of the patient. Okay, so in an 8-hour shift, there should be an expected 3 FDARs in the chart that should be done by the morning shifters, the PM shifters or the afternoon shifters, as well as the night shifters. Okay. And lastly, this is to improve concise entries that would not duplicate patient information already provided on the flow sheet or checklist. So make sure that it shouldn't be redundant or it shouldn't duplicate whatever informations that are being found in the patient's chart. So general guidelines for FDAR. So first, focus charting must be evident at least once every shift. So as what I've mentioned, you have to document it per shift. Okay, say for example, you are having your 12-hour duty. Okay, so for staff nurses, sometimes they are entitled to have their 12-hour shift, no? So in doing so, from say for example, you're in a morning 12-hour shift, so AM 12-hour shift. So 6 o'clock in the morning up until 2 o'clock in the afternoon, you have to use your black ball pen. And from 2 o'clock, 2:01 to 6 o'clock in the evening, you have to use your blue ball pen. Same as with the night 12-hour shifters. From 6:01 to 10 o'clock, you have to use blue ball pen. And once you are in your 10:01 to 6 o'clock in the morning and the next day, that would be considered as a red ball pen. Okay. So what if you will not be able to provide a particular charting on that shift? Then the nurse supervisor or the head nurse will call your attention and you have to go back to do your documentation because it's a no-no for you not to document into the patient's chart because of course you provided care for 8-hour shift. All the things that you've done to your patient, all the interventions given should be well documented. So focus charting must be patient-oriented, not nursing task-oriented. Okay, as what I mentioned, we have to focus to our patient. And the reason why we're doing so, it's because of the care that we've provided to our patient. Okay. Next is indicate the date and time of entry on the on the particular column. Particularly, this is not the first column. No, we have different format in Southwestern University Medical Center as an institutional basis. No, so usually the time column. Later, I'll be showing you an example, okay, as to how you do it. It is just beside the DAR column, no? So you have to indicate the date and time for us to identify as to what particular date and time that you documented that one for your patient. Next, separate the topic words from the body notes. So say for example, focus notes should be, the focus should be on a different column, followed by the time column and then the DAR column. Okay, so in our institution, we have already separated that one. All you have to do is to document it properly on a particular column. Next is document only patient's concern and or plan of care. So say for example, have per shift, hence general notes aren't allowed. So again, we have to be guided with a smarter format, and one of which is you need to be very specific of your documentation. Document patient status on admission for every transfer to from another unit or for discharge. So if you are going to transfer patient to another unit, say for example, patient was admitted at the ward and patient deteriorated, patient should be transferred to ICU. As the nurse who handles the patient, you have to make sure to document prior to transferring the patient to the ICCU department. This is to make sure that there is a continuity of care, collaboration of care. At the same time, your communication with the other staff nurse who will be receiving you is noted. Follow the do's and don'ts. The do's and don'ts, okay, in documentation. That will be discussed later. It's not just the do's, but also the don'ts. So for 8-hour shift, again, black ink for morning, blue for afternoon, and red ink for night shift. And if you're having your 12-hour shift, use blue or black ink for morning shift, 6 to 2 and 2 to 6, and red ink for night shift, as what I've mentioned earlier. So specific guidelines, you have to begin with a comprehensive assessment of your patient using inspection, palpation, percussion, and auscultation. So do not forget the ADPI, because ADPI is very essential in terms of your documentation. So always start with an assessment, okay? Don't go directly with interventions, okay? So after assessment, again, diagnose, you plan, then implement, and evaluate. However, you have to evaluate from time to time. Even though that you're doing assessment, you can do evaluation, okay? Evaluation would always take place as needed. Include the assessment, collection of information from the patient, family, and existing health records, such as checklist, flow sheet, laboratory/result. Sometimes data couldn't be taken from the patient alone, but it could be taken from the significant others. Why? Because the significant others are also there to observe the patient. However, this is just applicable if your patient is intubated or couldn't speak, or the patient is in critical condition but doesn't have any subjective cues. You can you coordinate with the significant others or the next of kin. A very good example are patients that have special conditions, okay, those who couldn't speak, okay, those that are aphasic. Pediatric patients, no, are also very good example. You can even coordinate with the mother or the father, okay? And next, you have to make sure that you also have to look into the chart of the patient, because sometimes laboratory do help, okay? The laboratory results does help. And at the same time, looking into the laboratory result of the patient, you will be able to identify what particular condition is the patient experiencing. Okay, say for example, you look at the chart and you were able to found out that the condition of the patient has electrolyte imbalance due to imbalances of the sodium and potassium of the patient. That could be a very good focus for you to identify. Next is you have to establish a focus of care to be addressed in the progress notes. So of course, we have to start first with the focus before we proceed to the DAR column. So here are the do's in your documentation. Okay, so when uh, when doing so, you have to write your own observations and sign over printed names. Sign and initial every entry. So that means to say na whatever observations that you observe to your patient, that should be documented, and it should not be coming from other nurses or other healthcare allied professions. Okay. Next is do describe the patient's behavior. So you have to make sure that your clinical eye is always present. You have to utilize it in order for you to describe it properly. Next, you have to use direct patient quotes when appropriate. So sometimes patients do speak, no? Some of our patients speak, most of our patients speak actually, no? So you have to quote unquote that, no? That could be a very good data that you can write in the data section. And do be factual and complete. Record exactly what happened to the patient and the care that was given. Okay, so whatever care that was given, you have to write it. Okay, so if the patient refused on the care that you have given, you also have to write it because that's also part of the scenario. So draw a single line through an error as mark in the entry error and sign your name. So say for example, there is a particular word in which you got an error. Okay, so it was a mistake, no, that you've done. Okay, so you should not use wipe out. Okay, you should not use the plaster system that you're going to obliterate the word or the words. Okay, but you have to draw a single line and write the word error. No need for you to place your signature or your initials at the upper or even in the side part, no? Do use next available line to chart and make sure you are not skipping specific line because in charting, it should be in a continuous process. The format should be in a continuous process, okay? Do document patient's current status and response to medical care and treatment. So what was the response, no? You have to document that. I think that is part of the format. And you have to write legibly. Do use standard chart forms based on institutional policy, no? So when you're having your duty in Southwestern University Medical Center, we have this kind of format that we provide. If you go to Soto, they also have this different format that they provide, but the same content as they're using FDAR or even in Eversley Child Sanitarium, no? They also have their own different format, no? But still, it has the principles of writing it in an FDAR way. Do use only approved abbreviations. So I think this was discussed in your fundamentals of nursing, no? So there are abbreviations that we can consider in writing in FDAR because using abbreviations could um help save our time, no, as well as with our efforts. So, however, it's crucial because you have to use abbreviations that are approved in as part of your documentation. So here are the don'ts. Okay, so first, don't make or sign an entry for someone else. So say for example, your classmate wanted you to sign on a particular part or write his or her FDAR because she forgot to document it. So it's a no-no if you're going to write that or even in the staff nurses level, no? So if a staff nurse already went home and forgot to write her entry or his entry in the chart for FDAR, do not write that one for her because that could be considered as dishonesty or you are already tolerating the bad behavior, no, of the staff or student nurse. Don't change an entry because someone told you to. So make sure that if you are going to change something in the chart, it should be you who should do it and not your colleague. Okay. Don't label patient or show bias. No? Sometimes in observing our patient, we're too biased. No? based on our observation, no, it is not anymore factual, no. So make sure that when you are documenting or when you're observing to your patient, make sure that there is also collaboration. At the same time, patient also agreed based on the assessment that you have. Next, don't try to cover up a mistake or accident by inaccuracy or admission. Okay, so um, do not cover any mistakes coming from your colleague, because if there would be an investigation that would be done, certainly could we can find out if that is your own mistake or the mistake of your colleague. So don't use wipe wipe out or erasure, no, in doing so, no. So make sure na white inks aren't allowed when when doing an error. Okay, so if it's an error, again, you have to use a single line with the word error at the side of it. Next, don't throw away notes with an error on them, because sometimes in in that particular paper, there's already a nurse's notes, no, coming from the previous shift. And if you throw that away, that means to say that the previous shift also didn't able to make the FDAR because you've already thrown it away. So if there is already a large error or an enormous error that you're able to encounter, make sure to coordinate with your clinical instructor or your head nurse as to how to do it. Because sometimes if it's really a big error that you wrote it in the wrong page, we really have to make sure to put a single line on each particular lines that you have your entry, no, and then proceed then to the next line. It should be the intended uh, paper that you're going to write your nurse's notes. Next, don't write over don't write over the margin. Okay, so make sure na you have to consider the margins the in the page. Okay, so do not write anything outside of it because that could be considered as null. Okay, so make sure na whatever is inside the margin shouldn't be coming out, no, your documents shouldn't be coming out from the margin. Oh, by the way, I forgot the second one. Don't squeeze in a missed entry or leave space for someone else who forgot to chart. So say for example, your colleague forgot to chart on her shift, no? Sometimes we're fond of leaving spaces for her to write her notes, but it shouldn't be done that way. You have to continue your charting directly as to the first pajud, no, the first nurse who tried to write, no, the FDAR before the one who forgot to provide her entry or his entry. Okay. However, you have to consider that by talking to your head nurse or to the nurse supervisor so that we will be able to call the attention of the staff nurse or the student nurse who wasn't able to provide a certain entry on his or her shift. Next, don't use meaningless words and phrases such as good day or no complaints. No, so sometimes student nurses are fond of doing this particular example. No, sometimes they say na a patient don't have any complaints. So if patient is still in the hospital, there should be a problem that you can identify because you're still in. Okay, so you have to make sure that you extract data coming from your patient based on your assessment. So that is why assessment is very important. Okay. And do not use a pencil, but you have to use the proper color of your ball pen on a particular shift. Sometimes students are fond of using pencils, no? So for staff nurses, they're already oriented to use ball pens, no? So I'll show you a very good sample of your FDAR. Okay. So as you can see, this is divided actually with 5 columns. No, so in the first column you have your date. There's no specific format of your date. No, you can write it completely July 9, 2012 for as long as there is a date, or you can write in that particular format and then provide your shift. No, so in this sample, it's 6 to 2. So for the focus, we actually have one focus for this, no? So readiness for enhanced breastfeeding. However, before you have your first focus, you need to have your receiving assessment first. This is very important and crucial because in doing so, receiving assessment is vital because it's one way for us to know what is the condition of your patient when you receive it from the previous nurse or for your shift, okay? Sometimes during the endorsement, it is not relevant anymore to the condition of the patient. In the endorsement, it says that the patient is stable. But when you try to assess your patient during your nurse's rounds, patients sometimes aren't stable. Okay, so it's very important to do your receiving assessment first prior to the first focus. Okay, so in receiving assessment, it should be a data. Because since it is an assessment, it's more into data because it is based on your observation to your patient. You're not doing yet an action. It's just an assessment. No? So say for example, around 7 o'clock, because 6 o'clock to 7 o'clock is a time for endorsement. So you went to your patient around 7 o'clock. No need to provide AM or PM. Why? Because it's already understandable that 7 o'clock stands for AM shift because of the shift in the second column that was indicated around 6 to 2. Same as with PM as well as with night shift. No, do not indicate if it's PM or AM. And also the color of the ballpen speaks itself. No, so it would also indicate if it's a morning, PM or night shift. Okay, because of color coding. So receiving assessment states here, now you received, okay, that's in past tense, patient sitting in the chair, awake, alert, and a febrile, okay? And receiving vital signs as follows, 36.1 degrees centigrade, pulse rate 78 beats per minute, RR 22 cycles per minute, BP 110/60 mmHg, with D5LR 20 drops per minute, okay? So in this particular part, vital signs is being considered because around 7 o'clock, we do not have any entry in the chart because in monitoring of vital signs, you have to take it around 8. You have to take it around 12. You have to take it around 4 o'clock in the afternoon and round the clock. Okay, so here, this is just a receiving assessment in which when you do your nurse's rounds, when you're in the bedside of your patient, what is the current vital signs of the patient? Okay, so that could be a valid entry. So around 9 o'clock, you're able to identify that your patient is already, I think this patient is an OB patient because it's more into breastfeeding, no? So this is a postpartum mother. Okay, so a very good focus is readiness for enhanced breastfeeding based on your assessment upon interaction, communication with your patient. So it's important to talk to your patient at all times, okay? Because that's one way for you to extract data coming from them. So first, you have to start with the data, okay? A data which is relevant to readiness for enhanced breastfeeding. Okay, it is not a data relevant to receiving assessment, but again, with readiness for enhanced breastfeeding. And as you can see, it is on the same column. Okay, so it's properly organized. Okay, so beside the time is the data. So it states receive patient sitting in chair, verbalizing concerns on how she can breastfeed the upcoming baby if she will have less breast milk production. So probably the patient's baby is still in the nursery, no, and it would be transported to her or it would be roomed into her now, no? So you're trying to ready the patient to do breastfeeding for her infant. Okay, so as you can see, there is also a line, no? So if there is a space towards the margin, you have to put a particular line just to make sure that nothing will be inserted on that particular line. See the word production, no? There is a line, okay? So put the line going towards the margin and it shouldn't be out in the margin, just towards the margin so that we can avoid insertion of words coming from your colleague or a different entry. Next, as what we mentioned, data is being followed by your actions. No? So around 10 o'clock, first thing you did was to assess the mother, assessed the mother's knowledge and previous experience with breastfeeding. Okay, so second, encourage the mother to follow a well-balanced diet containing an extra 500 calories per day. Okay, next is you encourage to continue her prenatal vitamins as prescribed by her doctor and drink at least 200 to 300 ml of fluid per day. Next is you recommended monitoring the number of infants' wet diapers. And lastly, you reviewed techniques of expression, breast pumping, and storage of breast milk. So as you notice in the assessment, okay, there's already 5 interventions that was being identified. Okay, and you can see that in the word milk, there is this line, okay, going towards the margin to avoid insertion. And I think there is still a continuation. Okay, so sixth intervention, you recommended using express breast milk instead of formula, or at least partial breastfeeding for as long as mother and child are satisfied. And lastly, you are able to discuss the importance of delaying the introduction of solid food until the infant is at least 4 months, preferably 6 months old. So in every action that you have, there is a specific time, So as what the guideline says, you have to make sure that there should be a specific time beside the data action response column for you to be guided. Okay, at the same time, to know on that to know that on that particular time, you're able to do these particular interventions. Around 1 o'clock, it's almost an hour prior to the end of your shift. Um, Patient verbalized understanding of breastfeeding techniques and benefits of breast milk. So your response should be based on the focus because your focus is enhanced breastfeeding. And in that way, based on the actions that you provided to your patient, a good response was an understanding or the knowledge of the mother was well enhanced, okay, based on your health teaching, okay. And I think this is a typographical error, so the line should be in the last part of the should be in the last should be with the milk, and the line shouldn't be extended below, so just up until the margin. No? So maybe it's because of the formatting now when I try to adjust it. Okay. And the last part is the end of shift endorsement. Okay. Around 2 o'clock. Why is it important for you to do the end of shift endorsement or end of shift assessment? Because you will be endorsing your patient to the next NOD. It's very important that you have to take note what is the condition of your patient prior to um, endorsing it to the next NOD so that the next NOD would have an idea on what's going on to the patient. Okay. And it's also important that endorsement should be done in the nurse's station because it's one way for us to have an open communication and the continuity of care is there. Okay, so endorse to the next NOD with an IV of D5LR 20 drops per minute, awake, conscious, responsive. And then you have to sign your complete name and then you have to sign, okay? For student nurses, provide your complete name and then you sign / the name of your clinical instructor. So the two of you will be signing the FDAR, okay? Right after it is being transcribed in the patient's chart. Okay, I think that's it. Right, so here are my references in APA 7th edition. Okay, so I think that ends the session. Thank you so much for listening, and I hope that you were able to learn from the focus charting discussion. Have a great day.